So carpal tunnel decompression surgery would be considered a routine operation. It would be considered a minor operation that can be done as a day case. However, as with any surgeries, there are risks and potential complications that patients need to be aware of. And also there is a very definitive recovery period. So in terms of complications, while these are quite rare, there is a risk, as with any surgery, of some wound healing problems. So a wound that's a bit slow to heal, potentially there's a risk of wound infection. Also, the scar that is on the palm can sometimes be quite sensitive, and that can take a number of weeks to settle, and patients can find activities like going from a sitting to standing position quite uncomfortable. In addition to that, they can also notice problems with their grip strength, and that can take up to 12 weeks to recover from. There are some rarer side effects where the nerve itself could be injured, and if that happens, there can be permanent problems with numbness in the hand, weakness in the muscles that supply the thumb, and also numbness in an area of skin over the palm here. Those are very rare complications, but they are worth being aware of. The other thing to mention is that I would say 90 to 95% of patients will have a good recovery of their symptoms, but there will be a small group where their symptoms persist. And that can be because there is another diagnosis at play. There may be a more proximal point of compression of the nerve, or they could have other medical problems that are contributing to pain at the wrist. And finally, carpal tunnel syndrome, it can recur. So in some patients, we see a large amount of scarring happening months after the surgery, and patients can represent with the same symptoms.